In this video, I answer a question on what causes pain in the upper back from a pinched nerve and how to get long-lasting pain relief from it. I cover the following in the video: what causes the pinched nerve in the upper back? Why does it keep coming back even after massages and stretches? And how do our providers approach treatment to produce long-lasting pain relief? For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical expert in chronic pain treatment, specifically for conditions affecting the neck, shoulder, low back, and hip. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long-lasting pain relief. All right, so this question came from Jill on YouTube. Let's read it. It says, about once a week, I find myself turning my head in the wrong way and pinching a nerve in my upper back that pretty much annoys me until I can get an adjustment or a massage. Usually one of those treatments helps it go away for a few days, but it always seems to come back. Why does the nerve keep getting pinched, and why aren't adjustments or massages doing much to keep it from coming back? Thanks so much for the question, Jill. And just a quick reminder, if you have any questions or looking for answers specifically on neck, shoulder, low back, or hip pain, please send a message to me. And if I think my insights can help, I'll be sure to get a video out to you. All the information to do that is in the profile or wherever you're consuming this video. So what causes a pinched nerve in the upper back? So I originally got my doctorate in chiropractic, and we were taught this idea that like the bone goes out of place and pinches on the nerve, the adjustment puts it back in place, the nerve is no longer pinched. I started asking questions in chiropractic school. I'm like, well, what about all the soft tissue around there and the muscles, like getting things stuck? What if we fix the soft tissue first and then the bone goes back in place? I always thought the bones were like the bricks and then the soft tissue is like the mortar. So I'm like, why do we keep putting the brick back in place? Let's fix the mortar so it doesn't keep popping out of place. So when I hear someone saying they have a pinched nerve, really what's happening first is inside your muscles, in and around your neck, and in your ligaments as well. You know, with bad postures from sitting too much, looking down at your phone, just not being a normal human, your muscles get overstretched, they get overworked, they develop this stuff that's called adhesion, also known as scar tissue. It's like a glue that gets inside the muscle. Makes it really hard for everything to stretch and contract. When the adhesion forms, first thing that happens is it makes the area less flexible, and then it makes it weaker. But then what happens over time is that adhesion gets much bigger, and then eventually what it does is it gets stuck to the nerves. And most specifically, there's these little tiny nerves that come out in between the bones and the neck. They're called the nerve roots, and they come out through these muscles that are called the scalenes, and then eventually they get caught as well. So nerves are built with about 15% of like extra slack to help them move wherever they go. What happens over time is eventually that nerve gets caught, and then below that it starts to pull more and more. And then what happens is when these are inflamed and there's causing problems, they actually control different areas in the back, and they radiate some pain, which basically means they shoot some pain into the back, maybe down to the shoulder, into the arm as well, and these things called sclerotomes. And usually sclerotomes is just like a referral pain for these nerves up in here getting really jammed up and really getting beat up with all of that adhesion. And a lot of times when there's a lot of adhesion in there, the nerves are caught. It tends to be a little bit worse in the morning, especially when you're sleeping on it. Those muscles have been kind of just jammed up and fully inflamed. So when you get up and you turn your head, like Jill's saying, she turns her head each way, and this nerve starts to get pinched, or gives that feeling of a pinch, and it's coming back through here down into the middle part of the back. But that's where those sclerotomes really like to radiate. So why does it keep coming back even after massages and stretches? The first thing that happens is there's this pathway in your spinal cord. It's called your lateral spinal thalamic tract. Let's call it LSTT for short. Basically what happens is up that pathway, there's two types of things or sensations that happen. One is like vibration and movement, and the other one is pain. So when you get an adjustment, you get a massage, what happens is it stimulates some of these fibers, especially the movement ones, and it blocks some of that pain, so you temporarily feel better. It's kind of like with your, you get your thumb stuck in a door, and then what happens is you kind of shake it out afterwards. It kind of, you know, tricks the brain a little bit and makes that pain go away temporarily. But the problem that's happening is when you're going to get the adjustments, maybe lower down in the neck, or getting that deep tissue massage, like in the rhomboid, the mid back area, this is more of like the effect. It's not the actual true cause. And like I said before, getting the adjustment, all it does is move the bones around, but it didn't actually address any of that bad tissue in there, which is why this problem just really isn't getting any better. So how do our providers approach treatment to produce long-lasting pain relief? First is we just start with a very thorough and detailed functional evaluation so we can get exactly to the root cause of the problem. I always say if you don't know what the problem is, you sure as heck aren't going to be able to fix it. So our evaluations are very in-depth, very precise and focused, so we know exactly where the problem is, instead of just going like, hey, it hurts here, let's treat there. We're like, why is it hurting here? We're trying to get real answers about what's going on. Once we establish what the problem is, we use a functional-based treatment to free up that nerve entrapment. In order to treat those nerve entrapments, they need just the right amount of depth and just the right amount of tension. And what happens a lot of times when providers find that area, they're usually too compressive on it. It hurts when they do it. Temporarily it feels better because it's stimulating those nerves and that LSTT that we talked about. But what happens over time is it didn't actually fix that problem, so it comes back right to where it is. So what I want to link up in the video first is a detailed treatment of me treating a nerve root entrapment in that area, so you can see how precise and focused it is. So I'll link that up right now.
So we're here, we're going to sink in, we're going to back out, and we're going to tension, and we're going to pull with this other hand, just like that. It's going to push right back on you, and once you find that area where that tension is, that's where you're going to start the treatment. So essentially I found that area where it is, and you're going to start it very neutral here, and then what's going to happen is you're going to take that opposite one, that's going to get that to open up. And the first part of the treatment is you're going to sink in with this other hand. That's going to get your depth. You're going to come out a little bit. You don't want to be too compressive here. Maybe about 5 to 6 ounces of pressure, but you get it just right. And when you can fulcrum it, just like that, that opens up. So I sink in, I'm going to back off, and then I'm going to set some tension with a body lean. And then I'm going to take this other hand where the base of the occiput is, and I'm going to pull it and force that to come through just like that. I'm not moving a lot. It's coming right to me.
So just a little take home on the treatments. You can see it's very precise, very focused. We're not in a rush. It's done in the right way. It's getting to the root cause of that. And a lot of times those areas are very tender, very sore, and they can't handle a ton of treatment. So the treatments that we do, they're very effective, but they're short and brief, because if we get in there and we treat too aggressively, it's going to beat up that area a lot more. I always say treatment is like a medication. You want to do enough to be effective, but you don't want to overtreat it. So we get just the right amount of dosage so we can free that nerve up. And when you free that nerve up, everything else around there can relax. You're not getting these symptoms as often. And then once we do that and we get things freed up and moving better, we also show you how to limit some load factors of modern society and reduce the buildup of the stress on the nerves. We help you with some postural awareness, some lifestyle and dietary stuff, and even some corrective exercises to stimulate and build up this front part of your neck, which has a core just like your lower body as well, to make sure that these problems don't come back and you actually get some long lasting pain relief. So that's all I got in the video. In all honesty, if you're tired of doing countless adjustments and massages, really only to get a small window of relief and have the pain come back a few days later, then click the link in our profile to learn more about our revolutionary treatment process that helps identify the true cause of the problem and get you on the path to long lasting pain relief. I appreciate you watching the video, and I'll catch you on the next one. Bye.